Let's try to identify the section of the abdomen taken at the level of the T10 vertebrae. First, let's try to identify the orientation of the specimen, right? So this is the anterior part, this is the posterior part. How do we say? Again, look at the vertebra, right? This is the T10 vertebra with the vertebral canal and the spinal cord within it, right? So this is the posterior part, this is the right and this is the left part. And how do we say this? See the huge liver on the right side, the stomach and the spleen on the left side. Let's try to identify the structures, okay? Actually, we should have identified the xiphisternum here, but it is not seen. Instead, we can see the linea alba and we can also see, can you see that ligament? What is that ligament? That is the falciform ligament. Can you see it? So this is the falciform ligament marking the division of the liver into left and right anatomical lobes, right? We can see the cut end of the ribs, right? So these are the cut end of the ribs that we can see. Here we can see the thoracic vertebra, we can see the erector spinae muscle, right? Now what are the other structures we can see here? If you closely observe, we can see the cut section of the diaphragm, right? Can you see this? This is the peripheral part of the diaphragm, right? Then we can see within the liver, right? What is this structure? This is the inferior vena cava. What are these? These are the branches of the hepatic vein, right? Then what about this blood vessel? If this is inferior vena cava, what should be this? This is the abdominal aorta. What is this? This is the stomach. We have the spleen. If you take a look at the section of the abdomen at the level of the T11 vertebra, we will not see this important organ. Now what is this organ? This is the cut end of the lower lobe of the right lung, the lower lobe of the left lung. This is how we can differentiate between the section taken at the level of T11 and T10. Remember, at T10 we will always identify the section of the lower lobe of the lung. We can also identify one more important ligament here. So can you tell us what is this ligament now? Right? Now what is this ligament that is extending from the liver onto the stomach? So this is the lesser omentum.